since we really started this process of addressing COVID-19 in our county. As of yesterday, and our website will be updated shortly, we had 969 cases in our county, and unfortunately we've had 29 deaths in just our county. This is updated every day, around sometime between 11:30 and 12. And if you're not already going to the county's website, we really hope you are, and it's just coronavirus.cchealth.org. City of Lafayette has done a fabulous job of getting information out to everyone, so I think you all have that reference. So I wanted to talk a little bit about orders, because there are state orders coming down from the governor, and then there are county orders that are offered by our county health officer. Now, a lot of people don't realize the Board of Supervisors, we don't get to weigh in on these factors. These are orders that under state law, when you have an emergency of this magnitude and an emergency is declared, or when you have a pandemic or other very contagious illness, the health officers are empowered to take whatever decisions, make whatever decisions they feel are necessary to protect the community. And there's a good basis in that. You don't want politics interfering in a time like this. You want science and medicine prevailing and making those difficult decisions. So we have had a series of orders, the stay-at-home orders, stay in shelter in place. And so what came out recently, which went into effect on Monday, was a change of our shelter-in-place order. And some of the most significant changes included, of course, all construction is allowed, but following appropriate protocols that really take into account the necessary social distancing. Through all of this, we have to keep in mind we are having new cases every day. It is still in the community, and all of these efforts are really intended not to cause a resurgence, not to cause a new wave of cases. Residential, commercial real estate transactions are allowed to fully resume. And one of the more unusual, helpful things is that now child care, summer camps, educational, recreational programs for children can now be provided for those whose parents are working, those who are working in allowable professions, even those who are working from home. And what we require with that is that the classes need to have 12 or fewer. It has to be a stable group, so you don't have kids coming in and out, potentially spreading the virus, and that you have very stable, consistent instructors or leaders of those camps or classes. One great thing also is outdoor businesses may operate, and that's our nurseries, our landscapers, our agricultural operations. Businesses need to still ensure any allowable business that personnel and customers have face coverings when they come in, that they have appropriate social distancing. Businesses that are not yet allowed to open their doors need to be planning for how they're going to effectively implement social distancing and related measures so they can reopen. All residential moves are now allowed. For a while it was very limited to sort of essential moves, and one that I've been getting great response to is outdoor recreation is allowed if it doesn't encourage gathering or high-touch equipment. So things like golf, things like tennis, where you can really engage in an activity while maintaining social distancing, but you don't have to share equipment. On the other hand, something like baseball, softball, even bocce ball, those are much harder to create that level of social distancing. And so we have these being our county orders, and I think most may be aware that it's not just Contra Costa's health officer, but the health officers of the other major Bay Area counties, as well as City of Berkeley, that has their own health department, have been working together to have consistent orders for the Bay Area. And the reason for that is we really are a shared region. We share our economy, our transportation, our transit. There's great wisdom in having consistent orders so that you don't have, for example, someone in San Ramon saying, oh, well, I can go over to Dublin and cross the county border and I can do whatever I want, if we had very inconsistent orders. Now, interesting, the governor has come up with, his phases, and stage one is sort of the area that we've all been in, which is staying at home, flattening the curve, only essential businesses opening. And that's where we have been as a county. What we like to say is our most recent order that came into effect Monday is sort of 1.5. The governor's talking about going on to point two, stage two, which would then be opening more retail, manufacturing, offices where telework is not possible, opening more childcare with social distancing protections. And so what our health officer has told us so far is, currently the Bay Area health officers have been looking at what's been proposed by the governor, which still is not in sufficient detail for them to really take a deep dive in. But they are very reluctant to jump into this next stage two until we see in the Bay Area the impacts of the changes we just made. The biggest concern is you want to make these changes very incrementally. You want to see the impact, and if we see a surge in cases, then we're going to want to roll things back a little. So there's a little hesitancy. They're going to, of course, look at the new order by Governor Newsom when it comes out in greater detail tomorrow, but there tends, sort of setting expectations. The realistic expectation is our health officers are not going to be as comfortable opening a next increment until we really see how we've been impacted by what we've done already with allowing construction, outside businesses, things of this nature. So I think that gives you sort of a general overview of where we are with these new orders and sort of where we're going.
Thanks, Supervisor Anderson. Appreciate that very much. I'm going to move right over to Dr. Radhakrishna, who is with the Public Health Office. And Dr. Radhakrishna, if you could just give us some sense of where we are today, that would be really helpful. Thank you.
Thank you, Supervisor Chair Anderson, Mayor Anderson, our local law enforcement, city managers, mayors, and the community at large. This has really been a partnership between broader government across the state, region, localities, and we really appreciate the sacrifices of the community. I'm going to give a brief overview of the pandemic here in our backyard and what are some of the indicators that we're looking at. So in the US, we now have 1.2 million cases and 72,000 deaths. In California, 55,000 cases and 2,200 deaths. And in our county, almost 1,000 cases and 29 lives that have been lost. In the city of Lafayette, 20 cases. And what this tells us is that more Americans have died from coronavirus than the Vietnam War. It's actually the #2 cause of death right now, with heart disease being #1 and cancer being #3. An American dies every 45 seconds from this virus. So we need to be very humble and cautious as we continue to study it and make our orders and recommendations for the public. The good news is, thanks to your sacrifice and our partnership, we've actually saved likely thousands of lives in our county. The initial projections showed numbers in the thousands to greater than 10,000s without the stay-at-home order in place. And thanks to almost an 80% adherence to our recommendations, looking at traffic data and cell phone data, we've not only flattened the curve, we've stretched it out and saved a lot of lives across the Bay Area and here in our county. So we're grateful for that. We want to say that it's been 90 days now. On February 5th, the Travis Air Force Base opened as a quarantine site. I was on call that week dealing with cruise ships and passengers and the first cases being reported in Santa Clara. And looking back over those past 90 days, it's been a tremendous testament to unity and partnership amongst government and the community, nonprofits, and businesses. And we're grateful for that. It's made a difference. What we've learned is there's been a lot of community transmission much earlier than we realized. That first death in Santa Clara was a month beforehand. So we know the virus is out there and has been there for a long time, and we're grateful for the compliance with our stay-at-home measures. The reason we've taken the Bay Area 7 health jurisdiction approach, as Supervisor Anderson mentioned, is viruses and people cross borders, and we need that regional approach. We're grateful we don't have a situation like Italy or New York, and we're carefully watching other states that have started to open up a little more, like Georgia, Florida, Texas, and even looking abroad at other countries to look at data modeling. I'd like to briefly mention the 5 indicators that we're carefully looking at to make sure we're keeping the community safe. You can follow these on cchealth.org. We have 3 separate dashboards, and you can follow along at a local, county, or even regional level. So there's 5 main indicators that we're following to make sure that we can slowly and safely continue to open up society and the economy. A lot of people ask, why are we going so slow? So the first question I'll answer is why we took an initial 4-week approach. As Supervisor Anderson mentioned, construction, outdoor activity, real estate, more essential work is taking place this week. So in the first week, there'll be more movement and more virus transmission. In the second and third week, people may start to develop symptoms since it has a 14-day incubation period. And in the fourth week, people may get hospitalized. That's why we made an initial 4-week extension through May 31st, so we could track and safely see the effects of this initial opening. It's that dimmer, not the light switch, that we're slowly turning things on. It's taking our foot off the brake slowly, so we're not going from 0 to 60, but we're going more from 10 to 20 miles per hour in a safe manner where we can monitor the effects. So those 5 indicators that we've gotten some questions about that I'll briefly explain are: number 1, are the number of cases and hospitalizations flat or decreasing? Fortunately, the number of hospitalizations has been going down to the 40s and 30s, and now we're in the 20s. Amongst our 9 hospitals, we do have enough capacity to handle that number of infected individuals. And the number of cases has been increasing, and we anticipate that to increase as we test a lot more, but we do have the capacity to handle that. Indicator 2, do we have the number of non-surge staffable hospital beds to keep our community safe? We still need to take care of heart attacks, strokes, trauma that comes into our hospitals, other conditions, and we need to save enough beds for surges and outbreaks. And right now we're doing fine on that indicator, as well as the numbers in the 20s of hospitalized people with COVID-19. The third indicator is where we really need your help, which is doing enough community testing to really understand the virus in our county and in our cities. So the recommendation is, out of 1,000 people, 2 people should be tested every day. We're actually a long ways away from that. This week, we've been testing about 500 people a day, which is great across our county, but we want that to be more than 2,000 per day, or about a 5 times increase. That's why we're happy to announce we have more community testing sites that are free. No matter your insurance, no matter your healthcare provider, no matter where you live, anybody can get tested. Go to our website and you can call the number to get screened and find a testing site near you. And that includes not having symptoms. We're learning a lot more about this virus. It's not just fever, cough, and shortness of breath. It can be a change in your sense of smell or taste, feeling tired, weak, headache, sore throat, many different symptoms. And even if you don't have symptoms and want to get tested and think you may have been exposed at a grocery store to someone in your family, you can and should get tested. And that will help us do more surveillance in the community. Number 4, do we have the army of disease investigators to follow up on those testings? That's called case investigations for the positives and contact tracing, reaching out to those who are positive to call them and see who you've been in contact with if you have symptoms and if you need to be tested. That breaks the chain of transmission to prevent outbreaks, which we have seen in other areas that have started to open up. So we're training that army of individuals. We're using software to be able to get in touch with people and build that capacity for contact tracing. And finally, number 5, do we have enough of a supply of that protective equipment for our first responders, law enforcement, frontline workers, and health professionals so they can get it through their normal channel? We know pandemics affect the supply chain, and we want to make sure if there is outbreaks and surges that we can keep our frontline workers safe to keep the community safe. So those are the 5 indicators that you can follow on our dashboard. We're not there yet, but we are making steady progress. The state is opening up 3 testing sites in our county that they will staff and supply, and that will give us more capacity. So what that means for a city like Lafayette, if you have a population of 25,000, is you should be testing about 50 of your residents per day. And now you have the ability to do so. We know that this has tremendous impacts on our daily lives, on society, and on the economy, and we're factoring that in as well. Unemployment, poverty affects health as well. In and of itself, poverty takes 8 years off one's life expectancy. We can see an impact on adverse childhood experience during a prolonged pandemic, increased domestic violence, child abuse, elder abuse. So we don't take lightly what we're asking the community to do, and we're monitoring all of those impacts on the community more largely. But we do know that taking these measures has saved lives, and we will continue to look at the governor's indicators, but largely work as a region. The governor has the whole state to think about. A rural county on the border of Oregon that may not have a lot of cases or deaths may be able to open up sooner than a dense urban environment like Los Angeles or the Bay Area, where we still have a lot of cases and a lot of deaths. So it's that dimmer that we're turning on slowly. And before we move to some questions, I do want to remind people during these tremendously stressful times that Health Services has 3 mottos for you, which is to live safely, live healthy, and live well. It's that trinity of vitality, good sleep, good nutrition, and good exercise that can keep your immune system strong. And the World Health Organization reminds us to do the 5, not just last week or this month, but into the future to stay safe. And that's hands, elbow, face, space, and home. Hands, continue to wash them properly, thoroughly, and fully whenever you touch surfaces for a full 20 seconds. Elbow, continue to sneeze and cough into it, given that it's allergy season now. We never know what it's gonna be, if it's asthma or allergies or the coronavirus. Number 3, face, don't touch it. Humans touch their face 20 times per minute, and make sure to cover your face when going out into public. Number 4, space. Continue to maintain that 6 feet of physical distance if you're out in public, if you're exercising, if you're going to the grocery store. And home. Continue to stay at home when possible for essential activities, especially if you have a chronic condition or if you're elder. So I'll end with that advice of hands, elbow, face, space, and home. And we'll move on to more questions, but I want to thank everyone for their partnership and cooperation during these prolonged times. It's not a sprint or a marathon, it's an ultra marathon, and we are winning the battle and flattening the curve and saving lives, and we thank you for your support.
Thank you, Dr. Radha Krishna. We appreciate that very much. Well spoken. I'm going to move now to City Manager Nirup Srivatsa and also Chief Ben Aldrett. Talk a little bit about what's happening in Lafayette, and then we'll get to questions.
Thank you, Mayor Anderson, and thank you, Supervisor Anderson and Dr. Radha Krishna, for coming. I've certainly learned a lot from you today. I'm going to be brief. I just want to thank the citizens and businesses in Lafayette for complying with the order, and also for your generosity in reaching out and helping each other. This has taken a toll on our businesses and our downtown, and the City Council recognizes this and is offering a free business assistance program, which you can access on our website at lovelafayette.org/business assistance program. We have connected 53 businesses and nonprofits to date to federal and state funding. And this represents 325 employees in Lafayette. And the program has been able to procure over $200,000 in federal funding. This program is available to any business in Lafayette and any nonprofit. So please take this opportunity, call us, and we're here to help you. Thank you.
Thank you very much, Nirup. Chief, do you have a few words for us? Thank you.
First off, I do want to thank the community and echo our city manager's sentiments. The success of the PD relies on the success of our community and supporting us and what we're doing in enforcing the health order. Since the beginning, we've taken the approach of education before enforcement, or education through enforcement, if you will. And the reception we received from our community on the calls that we've had to respond to in regards to potential violations of the health order, our community has been great in respecting the officer coming out and listening to what the officer has to say. And from the beginning, your police department has tried to be thoughtful about this health order. Not just, we don't respond with a citation first, we respond to find out indeed what the issue is, educate if it indeed is a violation of the health order, and our community has done a great job of respecting that process and complying after we've had to do some education. To date, we have not had to issue a citation in our community, and that, again, is a testament to our folks. I know it's a little weird to see your police officers going around on the streets with face masks on. That's not part of the normal thing. A cop is supposed to be out there and friendly and smiling. But thank you for recognizing that we are wearing face masks when we're out on patrol. In regards to staffing, from the very first week that the order came out, we changed our staffing model to have a larger presence out on our streets. Obviously, with businesses closed, we had a lot of concerns, and business owners had concerns about break-ins during this closure. And on the weekends specifically, we've actually been staffing additional officers. We typically don't have that as many then. And so overall, crime trends are down. Crime does still occur, and a lot of those things are in the property crime realm. But again, I just want to thank everybody for partnering with us in this process. It really is a partnership. So thank you.
Thank you, Chief. Appreciate the work of your force. They've been doing a great job. And maybe we get some masks with smiles put on them or something. I don't know. That's something we can look at. Okay, so I know we have a lot of questions, and that's really the point of this panel, is to give people a chance to find out directly from the experts what's going on. So Jeff, can you begin to give us the questions we have?
Sure will. Thanks, Mayor Anderson, and thank you, panelists. We have over 50 people watching right now on Facebook. There's some questions that have come in there, but I'm going to take the questions in the order that we received them via email. I think that's just the best way to do it. So the first question we had, and this was from someone internally in the city, Governor Newsom has said that he will be shifting to phase 2 and lifting restrictions on certain types of businesses as early as this Friday. Now, I know we touched on some of this, but still, can we expect the Bay Area health officers to follow suit, or will the current restrictions remain in place?
And I did touch on it briefly. This is what the Bay Area health officers will be examining tomorrow when details of Governor Newsom's order do come out. However, as was so articulately stated, we want to see how well we've done, how we're doing with the loosening of measures we already did. So there's not a strong likelihood that we will jump right into that. Now, if we see our indicators that have been laid out, the 5 indicators, we're doing well, maybe after a week or two, we might see us adopting some of those. But again, we are a large state, and we have different rules, and typically when you interpret state and local regulations, state law prevails. But in this instance, from the start, Governor Newsom has made it very clear that if a county has a more restrictive ordinance for the health and welfare of that community, that is the one that should prevail, rather than just necessarily adopting the states, which might be a little bit looser. So as much as I do want to open businesses as quickly as we can, we need to do it safely, and we need businesses really to be planning how they're going to open. And I will also add, tomorrow at 10 a.m. there is an ad hoc committee meeting of the Board of Supervisors that we formed to look at the economic impact of COVID-19 on the community. And so tomorrow we'll be mostly just doing a sort of an overall listening to people, and then future meetings will be on a weekly basis, meeting with different sectors of businesses, or it could be religious organizations, or it could be recreational activities, to sort of help shape guidelines of when we get to that next phase, we can have them open their doors, be ready to do so in a safe fashion.
All right, then we had a question from Karen Melvini, and Karen would like to know, what are or what is likely to be the mandate in terms of gatherings for an outdoor wedding event scheduled for June 13th? Where is the closest place to obtain a wedding license, and what is the protocol for doing so under current closed for business conditions? And I did send Karen some information about the governor's order on virtual weddings and the clerk's office. But anything you'd like to add to that?
Yeah, I don't know that we'll be, again, my crystal ball is a little foggy as to when we'll be having gatherings. And I have to say, even though my 2 granddaughters are 5 miles from me, I have not been able to give them a hug since the last week of February. And it's hard, it really is. Our county clerk's office is setting up protocols to be able to issue marriage licenses, and that is on the county clerk's website. So we encourage anyone getting married to do that, and go ahead and come up with the best way you can make it work. Again, you're not going to have the police out there enforcing this. You've got to use common sense and not encourage large gatherings. And I went to my first Zoom wedding 2 weeks ago. It was fabulous. And our chief health officer, Dr. Chris Farnatano, he had to watch his own son be married on Facebook Live last week. So a lot of sacrifices going on, and we get that. We want to keep you safe.
Yeah, wow.
I could briefly add, ritual, ceremony, celebration is so important. And it has actually been an area of outbreaks that we've seen in other parts of the county, which is why we're taking this so cautious and safe. We've seen outbreaks in churches, for example, in other parts of the country. So we've been working with every sector, the religious institutions, the school sector. I just got off a call with the superintendents an hour ago about planning for high school graduation ceremonies in June. So we're here to provide guidance on how to most safely keep the public and those participating safe for all types of ceremonies: funerals, weddings, graduations, gatherings, reunions. And we are looking at providing some more guidance for the month of June. We don't know if there's going to be a number cap, 50, 100, or 200 on those. We don't know what percentage of it will be drive-in or drive-by to allow for some proximity for that experience to be felt a little more. And we may be a little different than other counties in how we move forward in that. We've been united on the big picture items for the 7 regions in the Bay Area, but these items are very personal and intimate. And as we really in the month of May get our indicators live and transparent on the dashboard and get prepared to open things up, I'm hopeful that we'll be able to have more types of gatherings in the summer, but we'll be slow and cautious in doing so.
Thank you. We've had several questions about the Lafayette Reservoir, but only one was sent in, but we've been getting emails and things like that. So Lynn Hedane asks, can we find safe distance enforcers sufficient to open the Lafayette Reservoir? Maybe with a closed kiddie playland, or take turns with either giant spray or wipe down every half hour. So what's the story with the reservoir?
Well, and the county doesn't control the reservoir. And so it's whoever's in charge gets to make those decisions. And East Bay Regional Park District has done a very good job of closing a few sites where they just didn't think you could have appropriate social distancing, but keeping those other ones open. And so we want people outdoors. We want you out walking and hiking, but with appropriate social distancing. So when I'm out hiking with my family, I wear a little face around my neck, and face mask around my neck, and I'm just ready to pop it up if I'm coming across someone in the trail. You just, again, using common sense. So we don't control the reservoir. It's up to them to decide when they're going to open.
And Jeff,
And I'll just clarify that the reservoir is actually under East Bay Municipal Utility District,
right,
and not East Bay Regional Park. So
Right.
I know John Coleman, our director, has been engaged on this issue. I know that he's aware of it, but I think they have yet to feel comfortable with having that kind of proximity on the reservoir itself. They are opening the rim trail, though. So there's a slow change going on there.
And if I could just add, we're actually taking a regional approach to parks, and we've put out a consensus statement as the 7 Bay Area health officers. I've been the lead for our county on parks, working closely with Alameda since we share the East Bay Regional Park District, that we feel strongly parks are part of our pandemic response, and we want them open as much as possible and as much as safe. It's essential for not just physical health, but also emotional and social health. We're seeing more screen time and sedentariness, which can increase obesity, chronic disease, not great for our kids. And we want people out, and the risk of transmission outdoors is very low. We're actually working closely with the parks to do a lecture series with UC San Francisco, where my alma mater, where I studied medicine. So you could certainly invite the East Bay Municipal District to attend those Thursday lecture series, where we're answering Park District's questions on infection control, transmission, how to protect the public, how to protect their workers, which I know is a big concern for some of the unions. And we're closely working with them to make sure both workers are safe as well as the public.
Okay, very good. Okay, Lynn had another question for us. This, I think, is for the city. This is Lynn Hedane asking, when might we begin to do in-person city council meetings? Possibly with fans going, guests masked, and air conditioning turned on high, windows open, hand sanitizers, entering and leaving, chairs set 10 feet apart, sanitized after each use. Any?
I would say when the county health officer allows us to congregate, whether it's 10, 20, 50 or more, we will, until then, we will do virtual meetings and abide by the directives of the health officer. I don't think this council and staff enjoy the Zoom meetings. I think we miss the public interaction, but we have no choice at this point but to follow the directives.
Very good. All right, let me see here. This is from Christine Yarouche, and she says, I noticed a recent increase in the number of COVID cases in Lafayette and was wondering if there is any contact tracing happening. Thank you, she says.
And yes, there is.
Yeah, we touched on that a little bit earlier, but perhaps I did notice myself that there were a couple more cases in Lafayette, but it didn't, I'm not a public health officer, obviously, but it didn't seem like a huge increase.
Yeah, I can give a little more detail. For a city with the number and sample size being so small, it's hard to notice trends. You also need to understand the ecosystem of risk. So somebody could have their residence listed in Lafayette, but actually spend a lot of time outside it. They may be an essential worker that's actually working in San Francisco and taking public transportation. They may actually do their grocery shopping in a different city. They may have been at some type of gathering or event that they could have contracted it. So even though you may see a couple numbers increase in a city of a small population, it doesn't give you a true sense of where the transmission may be happening, which is why we're trying to take a broader ecosystem approach. We do have enough capacity right now for contact tracing for every positive that we get. Those people are getting phone calls, are being asked who they've been in association with, and we're reaching out to those first or second degree of contacts to make sure we can contain it. And the more we're able to do so, the more we can drive down the transmission. So you should expect to see a rise in the number of cases as we test a lot more. People without symptoms, testing people who may be concerned. We're gonna find a certain number that are just positive without any symptoms and didn't even know it. But the more sensitive indicator for the outbreaks and the impact on our system would be the hospitalizations. And that's reassuring that that number is heading downwards.
Well, and the other thing I'd love to add is that we're really looking proactively at our vulnerable populations. And so particularly any congregate care facilities, whether it be a senior living facility, which I know Vice Mayor Kendall has been working with bringing together a lot of people to start proactively raising money to do testing in the Loma Linda cities to ahead of time. But we're also doing that because we have seen both in Orinda and in Pleasant Hill, we saw many deaths and very rapid expansion in those communities. So now that we have better testing capacity, we're doing that. And another great example of congregate care is our jail. Until yesterday, we did not have any inmate who had been tested positive with the coronavirus. But what we have done is we had a whole process in place. One, we've severely limited the people who are being booked simply because it was necessary. We've released most non-serious offenders from the jail, but anyone who does commit a crime that does entitle them to remain in jail, they're put in a quarantine area of the jail for 14 days. And we've been doing preemptory testing even before they're exhibiting symptoms. And so yesterday, even though one of our inmates was not exhibiting symptoms, he did test positive. We started immediately treating him in a separate area that's completely isolated from everyone else, even from the ventilation system, to ensure we don't have an outbreak there. So that's also very critical that we really, with our vulnerable populations where we're likely to have a mass outbreak if one or two people get it, we're really being careful in those instances as well.
Okay, great, thank you. Okay, this question comes from Amy Kokotis. She wants to know, her question is concerning the criteria used to lift the shelter-in-place order. I think we talked about this a little bit, but she says, I'm reviewing the CC Health indicators dashboard. And it says indicator number 1 requires a flat or downtrend in the number of cases for 14 days. Seems to me that we are already seeing that. We already know that COVID-19 exists all around us based on university studies. So increased testing will likely cause the case count trend to go upward. Why is the county not looking at the true risk of serious illness or death across our population to evaluate whether it's safe to lift the SIP? Sorry. Thank you, she says.
So very astute question, and I'm happy to go into a little more detail. I want to start more holistically by saying this is a package of measures that we're looking at. Come a week or two or May 31st, if we're a little short on one, that doesn't mean we're going to keep everything and the brakes on. We're going to slowly open, but this makes sure that we do so in a responsible way. Supervisor Anderson talked about our excellent proactive and preventative work in congregate environments with those experiencing homelessness, with the detention and jail facilities, with the elderly and congregate care facilities. We want to make sure we can provide the same level of protection should there be an outbreak at a grocery store or at a summer camp or at a pool. And to do that, we need to have all 5 measures moving in the right direction. We're not going to nitpick and if one is a little bit off, decide to not open up, but all 5 of them are interrelated. So when it comes to indicator number 1, the hospitalizations, the 7-day rolling average has been decreasing nicely. Amongst our 9 hospitals, we had a peak of up to almost 50 individualized cases hospitalized, and that's been decreasing to 40, to 30, to 20. So that is a very favorable trend. The other part of that indicator 1 is the number of cases. And as the questioner pointed out, as we do massive testing, double, triple, hopefully 5 times the amount of testing by June 1st than we're doing right now, of course we're going to see an increase in the rises of cases, but we want to make sure it's not exponential, there's not pockets of outbreaks that we didn't realize by testing before. So are we going to keep the shelter in place if we see a slight continuing increase in cases? No, but we're going to take all the measures together to make sure we have the contact tracing team in place to deal with those positives if they do increase.
Okay, thank you. Here's a question from Chris Lee. And the question is, there's been a lot of discussion and disagreement on social media regarding the enforcement of the rules of the shelter in place, social distancing, and mask wearing. Because some people believe there is no enforcement, they choose not to comply. Please explain the legality of the rules of shutdown and reopening and how these rules are enforced, including how businesses should monitor employee and customer compliance. She goes on a little bit.
Okay, because I was just going to say,
okay,
every order is enforceable by the law with a fine, and I'm going to let the chief talk about how he chooses to enforce it, and each city gets to decide that. We don't send the sheriff's department out to any place other than to unincorporated communities. You as a city get to decide how strictly you want to enforce it.
Okay. Chief Aldrich?
I'll start with the businesses first. When this order came out, I equated it to the rule that many businesses have: no shoes, no shirt, no service. Add no mask to that, and it's the business owner who says you cannot come in unless you wear a mask. We have a lot of good examples in our community of businesses doing that. I think Jeff gave a great example yesterday in one of our meetings of a business here in town. If we get reports of a business that is not using the protocols that are put in place with the health order, we go out and address that, educate them, and if that does not work, then it will be elevated to a citation if need be. So that's the business part of it. There is a component there where this is a social responsibility of everybody. I'll use the example I've given before is the police department is designed to police the 1, not the 99. A lot of the work we do in our community is because our community allows us to do that. They support law and order and they support justice. And so if all 26,000 residents decide to come out tomorrow, the 2 or 3 police officers working aren't going to be able to do anything about that, right? I mean, it's just a reality. And so that is why education has been such an important component of this health order, is that our community, we need their engagement on it. We need their compliance. Your police department is still going to other reports of crimes, and to just have someone who's going down and proactively inspect every business is not realistic. And so we have been driven by calls for service. And when we get a call from someone who says, either a business is operating in violation of the health order, they should be closed, etc. We have additional staff that have been addressing those calls for service.
If I could just add, we've been working very collaboratively with law enforcement and the district attorney's office to really take an educational approach to this. And I want to thank Chief Aldrich for really being the front line of that message and supporting the community. I also want to acknowledge fatigue. It's been a really long ultra marathon. Life is going to be different. Restaurants, schools, the governor said we may be further apart. We may have face coverings off and on at various times. And it's easy to get upset. It hurts my ears to have this on. I don't like it all the time. And we get it. And there are protests, big and small, from conversations to actually out in the streets in our county and across the nation as this event goes on. So we understand people's frustration. We want to make sure people understand the science that my mask protects you and your mask protects me. And because of this invisible enemy, where up to half of the cases have no symptoms, it's different than the flu where you get really sick on day 1. You may not get sick till day 3 or 4 and infect those who you love. That really wearing a mask and complying with these orders is a sign of love and generosity and being a good resident and member of the community to protect others and protect you and your loved ones. And we thank law enforcement for supporting us in that.
Okay, thank you. We have a couple more questions that came in, and then I'll move on over to Facebook. Here's one from Ken, and this is the email questions. Ken Sherwin asks, given the certainty that the virus will be with us through the summer and the consistent expectation from experts that a fall-winter second wave is probable, what steps are government leaders taking to ensure that we are not hit with a combination of some form of shelter in place combined with PG&E power shutoffs during the late fall season, late fall this year? This would be devastating, he adds.
But who do you want? Well, when we're working with PG&E to tell them don't shut off the power, and I'm saying that somewhat in jest. Obviously, we can't control a major, incident where we're at high peak fire danger, but we are getting prepared, and that's why we're talking about having not just hospital capacity, not just having our ventilator ICU bed capacity, but having the personal protective equipment, the PPE available, so that if we do see a surge, that's where too the tracking and tracing is so critical. And while we've gone from, I think we used to have 12 to 14 trackers who would, track down measles, tuberculosis, things like that, we've hired now up to, right now we're close to 75, between 75 and 100 people, and we're continuing to train new people. The governor keeps telling us he's going to launch a tracking tracing program, and we're really looking forward to when he does that. We still don't have any details from him about what that looks like. Those are the tools that are going to enable us to do that. And if we see a spike, that's when we are going to have to reinstate the things that we've loosened to really make sure that the community is safe. Because yes, every model you look at, and you look at past pandemics, it's very, very possible we could see a resurgence. And so we're using this sort of the eye of the storm period to be even better prepared.
Great.
Well put.
Oh yeah, go ahead.
Add a few details that they say that this pandemic is actually a fire drill for what's to come with climate change. And we know that the situation is worsening. I grew up in the Midwest and had snow days, but now my kids are experiencing smoke days and heat days. And that is going to be here this summer and fall, and it is part of the new normal. Fortunately, we do regular drills with cross agencies to prepare for these types. We've done scenario planning to make sure we have enough masks should there be smoke emergencies and heat emergencies and power shutoffs and virus spread in the fall. We don't want to create unnecessary panic and fear, but we do want the public to know that we've been thinking about this for months and we've been planning accordingly. And so during the eye of this storm, as Supervisor Anderson mentions, we're taking a lot of preparatory steps to build the technology, the outreach, the workforce, so we can reach everyone and the most vulnerable during those tough times where we may get a double or triple whammy.
Okay, very good. I want to go through these next couple of questions pretty quick, so we make sure we get over to Facebook. We had a question from Kazanoff. She talks about social gatherings outdoors. I think we covered that, so I'm going to get to her second question. She wants to know, what about weekly or bi-weekly house cleaners? The order talks about gardeners, pool care, child care for those who work in permitted businesses, but not house cleaners.
So at this time, unfortunately, no. We all feel it and are grateful for our essential workers. And I'll point to a study that was done last week by UC San Francisco in San Francisco in the Mission District, where they took an entire neighborhood and they tested 4,000 people without symptoms over a weekend. And what they found was, with a lot of essential workers and people going out to do things, work in grocery stores, work in pharmacies, that didn't have symptoms, a lot of people tested positive. Those could be the people cleaning our homes that don't have symptoms, that may be traveling from outside areas outside our city and do have that risk being in close contact in our homes. So at this time, until we have the sufficient capacity to test all those individuals, to respond with contact tracing, and to stop the chain of transmission, unfortunately, the answer is no. But we're hoping for this summer to be able to open up for those types of professions.
And we are encouraging, I miss my house cleaners. I will tell you, I've gotten back to really appreciating my vacuum. And if you're able to, keep paying your house cleaners, because they are part of our most vulnerable people in our economic system that we have. And so if you're able, keep sending them a check until we're able to have them come back into our homes.
Okay, while I head over to Facebook, we did have a couple of email questions about summer camp. What's the prognosis for summer camps and activities during the summer?
And that's that very interesting nuance that our health officers added. It's got to be a camp with 12 students or less. They have to be part of the same cohort, and it's supposed to be for parents who are allowed to be working, which pretty much covers any parent working from home with someone who's an essential worker. But you do have to follow certain guidelines if you are hosting that camp, to use what you can, especially with parents dropping kids off and other things. However, within the cohort, you're not required to have that same level of social distancing. And so we're finding, even though community pools are not open, you may be able to have a summer camp for 12 kids swimming, or same thing with gymnastics. And part of it is, yes, we realize you're opening the door because potentially any one of those children could be carrying the virus, but it's also really important that we have the ability to get parents back to work and that there's a safe environment for their children to be in.
Little more detail is, you're all welcome to call our call center, which is open 7 days a week. They're equipped to answer more details, and we put out a 2-page modified guidance for childcare that we've been using in our emergency childcare centers, and that applies to the summer camps as well. That goes into a little more detail, but it uses that bubble concept of a household of about up to 12 is safe as long as it's stable. Now, we're giving some leeway. We're not saying that you cannot change a camp every week, but we're recommending a 2-week or a 4-week camp is better, since it's more stable and there's less mixing. We recommend against day camps where you're shifting the groups of kids. Jurisdictions like New Zealand and even New Brunswick is even recommending neighbors get together to spend times in these types of bubbles as a slower and safer opening.
Jeff, you're muted. We can't hear you, Jeff.
Let's unmute me. Here we go.
Yeah, now we can hear you.
Okay, thank you. I'm going to go just down the list of the Facebook comments. We had a lot of folks thanking us for this broadcast, and we want to thank them for joining in. They found it very, very helpful. There's one question about, are house painters allowed under the current order?
They're now within that construction exemption that exempts them. They're now able to do that. But again, there's appendices to the health order that describe the safe social distancing that anyone working in the construction industry, including painters, need to follow to keep themselves safe and keep their clients safe and the workers. So it's, yes, paint away.
Okay, great. Here's one from Robin Wells, and she says, as you know, COVID-19 has exploited pre-existing vulnerabilities in our society. As a faith leader with access to emergency relief funding to respond to COVID-19, I'd like to know, what are the gaps that the faith communities can fill in the short term, next 3 months, while we move to online activities and continue to be sheltered in place, not gather in large groups?
Thank
So
you.
what can the faith-based community do to help?
Yeah, so I'm on a state committee for equity, and we're closely looking at vulnerabilities and disproportionalities in terms of particular groups, be it based on age, be it based on zip code, be it based on race or ethnicity or type of occupation. And the faith community has done a lot and will play a huge role. I'd guide you to 211, Tom, who is actually the chair of the volunteer committee. And we have a social needs committee task force that meets once a week that includes members of the faith-based community to talk about long-term planning and how we can engage all of the powerful assets that that community has to offer. So I'm frequently on those calls and happy to partner more, and thank you for your offer. We're eager to use all of your big hearts, pocketbooks, and brains in caring for the most vulnerable moving forward.
Great, thank you. Brooke Peterson on Facebook asks, can Lafayette help with putting together a system to do a system in place for 50 people to be tested a day?
Well, and let me talk a little bit about what we are doing right now, because the nice thing is our system is free, and I'm going to give you the phone number if anyone wants to call to make an appointment. It's 844-421-0804. And to get tested, you have to have an appointment, but right now we've got it available in Concord, in Martinez, Pittsburgh, San Pablo, Antioch, and then today we have opened up the 3 state sites, which are not drive-through sites, but they're ones where you get out of your car and you walk in, and those are at Heather Farms, in Pinole Library, and at Liberty High School in Brentwood. So what we would love to encourage is all of you in Lafayette, go to one of those sites and start getting tested. We are hoping to have a site down in San Ramon. They're still working out final details of an agreement for that. So test centers are accessible, they're available, and we'd love to see more people moving forward. I know like I mentioned, I understand, Vice Mayor Kendall is working to do testing, raising money to do testing for some of the congregate care facilities within there. That's a great partnership, and there may be the opportunity to expand testing beyond that. But right now we're trying to direct people, just as you might imagine, to have a test center site. It's a lot of work. You've got to have everyone in their PPE. You've got to have the collection tools. It's not something that you just can sort of, casually have one person just sitting around waiting to do, other than, of course, in a lab. And there's been discussions of whether or not more of our pharmacies might be able to do that. But for the scale of testing we need to do, which is 4 to 5 times the amount we are currently doing, we'd love to direct people to these test sites that we're opening up so rapidly to get you tested that way.
Okay, great.
So
We
if
only
I
have
can,
about a
if I can
minute.
just jump in, Jeff, let's get that added to our website,
Okay.
Jeff, because
Yep.
I think that information is something that we just haven't had. And as more sites become available, whether they're closer or farther away, people just need to know that they're there and what they need to do. So we'll pass that information along.
Right, and we do have the COVID-19 site right on the front page of our homepage for people to check, and we do have a lot of resources there, but we'll make sure that that's updated. All right, we just have about a minute left, so I'm gonna, let's see, there's one more question. Well, there's a few, we're probably not gonna get to them, but Cynthia Rodriguez on Facebook wants to know, where can I find a list of all 5 measures? Is that on the county's health page?
Yeah, and I'll just briefly add on the testing. Thank you, Supervisor Anderson, for really pushing it. And it's part of destigmatizing it, just like with HIV. We don't know, and we recommend everybody get tested, and we now have the capacity for it, and that will help us understand the disease better and be able to open up in a safe and responsible way. Our dashboard was just updated to have 3 dashboards, actually: an overview, the hospital data, and the indicators. So you can go to cchealth.org and then click on the coronavirus link on the top, and then the dashboard link, and there's the specific dashboard for the 5 indicators.
Right. And I'll note again that your dashboard, as well as a whole bunch of other resources, are right there on the lovelafayette.org's homepage, right in the middle under COVID-19 resources. So it's there for people to see. Okay, Mayor Anderson, I'm going to hand it back to you to close things down and offer some closing remarks.
Well, I think really I'd like to let some of our panelists give us closing remarks. Let me start with Chief Aldrich, and we'll work our way backward. So, Chief?
Again, thank you to our community for your support of your law enforcement doing what they need to do during this time. Real quick on PSPS, I do want to let folks know watching that the city's been really focused on preparation for this year. Jeff will put up a link for alertwildfire.org. We've installed a bunch of cameras, fire cameras in our community. We've wired a bunch of intersections up so we can run the power to them during a power shutoff. So it's definitely at the forefront of my mind as we're entering the summer, and it has been since the last PSPS event. So we're definitely doing a lot of things, and there'll be more to come on that. So thank you.
Excellent. City Manager Savatsa. You're muted. Still muted.
Sorry about that. I wanted to thank Supervisor Anderson and Dr. Radhakrishna. This has been a really informative session, and I know I can speak for the people who are listening in that you are truly dedicated to managing this pandemic and also in a very cautious, logical way, reopening the economy and the world as we see it today. So thank you so much. We're here to help you and look forward to a time where we don't have to do Zoom meetings to see each other.
Dr. Radhakrishna.
Prevention is invisible. It's really hard to convince the public the impact that their measures have made, but you have saved lives, and we want to thank you for that. It's really a historic moment that you'll be telling relatives about for generations, what we're going through right now. How we respond and how we treat each other will be remembered. And so we thank you for unity. It's part of the word community, and we really see that and are amazed every day in the stories that we hear of how we're supporting our neighbors and the vulnerable, having tremendous patience through this very challenging time. And we really want the trust of the public, so we're trying to be as transparent with our measures and our thinking around really tough decisions. And so please continue to give us feedback. The governor is accepting feedback. He has an input email address where he's accepting feedback. We are as well. And we're here for you through the long haul. We've prepared for this. This is once in a century. We will face future challenges and emergencies, but we're very united with all of our partners. And I want to have a special shout out to Supervisor Anderson, who's really stepped up and stepped into this with us. From week one, we were doing hand washing videos together, not knowing what the future would hold. And 90 days later, here we are. But we're really united using science and data to protect the public. And we're grateful for our partnerships in unity. Thank you.
Well, our Supervisor Anderson, closing words.
Now, where I started, thank you to the community. Thank you for going on this wild ride that we're all on together. It changes every day. Every day we have new information, new response. Yes, we understand the sacrifice, both the emotional as well as the financial impact on our businesses. We are doing everything we can to help you reopen as safely as we can. And I have full faith and confidence in our health department with the direction they've gone. They're not falling sway to the politics, the pressure, trying to look good. They are making decisions that are in the best interest of each one of us and to really keep our community safe. So thank you all, and thank you for watching out for one another. When I go in next door, what warms my heart are those acts of kindness. The people who post things like, if your family is going hungry tonight, don't let that happen. Private message me, we will feed you. That's what we need to be doing as a community. So thank you.
And let me just thank all of you for participating. This is really, really great. I think our community is one of those communities that really does have a sense of place. And because of that, the words that you're giving us are things that we can use to talk to our neighbors and friends as we pass 6 feet apart from each other on the trail and say good morning. There's this real problem of the economic impact that is affecting everyone. And I know we've talked about it. But the key piece here is to understand that it is understood by those who are creating these protocols and orders that this is happening. It's not in a vacuum, but it's necessary that we take these measures to assure a future. So thank you all for what you're doing, each one of you, and thanks for participating today. And Jeff, thank you for coordinating this. And with that, we'll call it a day for lunch with the mayor, but hopefully people will be able to find more information at the City of Lafayette website or the county health website to help them either get testing or information about changes in the order. So thank you all.
Thank you.